to a new MCQ discussion series on the urinary system. Question number 1. The nurse understands that urine flows through a Foley's catheter by the principle of option A, higher pressure to lower pressure, option B, gravity, option C, suction, option D, siphoning. Answer option B, gravity. Urine flows through the catheter to the drainage bag is by gravity. So the drainage bag is always positioned lower than the level of the bladder with the catheter. Other options do not operate during urinary drainage. Question number 2. Which of the following statement is not true regarding phenosopyridium? Option A, it is an urinary analgesic and anesthetic. Option B, it causes bladder spasm. Option C, causes bright red orange urine that stains clothing. Option D, it causes diarrhea. Answer option B, it causes bladder spasm. Rationale: Phenosopyridium does not cause bladder spasm. Contrary, it provides a soothing effect on the urinary tract mucosa. It is an urinary analgesic and anesthetic. It causes bright red orange urine that stains clothing. Adverse effect may be diarrhea, rash and blue to purple skin discoloration. Question number 3. The amount of blood flowing to the kidneys per minute is option A 20 to 25% of the cardiac output, option B 30 to 40% of the cardiac output, option C 35 to 40% of the cardiac output, option D 40 to 50% of the cardiac output. Answer option A 20 to 25% of the cardiac output. Rationale: the kidneys receive 20 to 25% of the cardiac output under resting conditions, averaging more than 1 liter of arterial blood per minute. Question number 4. Most of the water and electrolytes of the glomerular filtrate is reabsorbed in the option A proximal tubule, option B descending limb of loop of Henle, option C ascending limb of loop of Henle, option D distal tubule. Answer option A proximal tubule. Rationale: most of the water 65% and electrolytes of the glomerular filtrate is reabsorbed in the proximal tubules. Then the descending limb of the loop of Henle, ascending limb of loop of Henle and distal tubule are water impermeable. Question number 5. The nurse is assessing a patient admitted with acute pyelonephritis. Which of the following symptoms she is expected to find? Option A, urinary retention. Option B, feeling of coldness and hypothermia. Option C, high blood pressure. Option D, flank pain on the affected side. Answer option D, flank pain on the affected side. Rationale: the patient may complain of pain on the affected side because the kidney is enlarged and might have formed an abscess. Patient will have dysuria, urgency and frequency, not retention. Onset of the disease is often with chills and fever and not hypothermia. High blood pressure is not associated with pyelonephritis.